So most people know Samsung for our smartphones, our TVs, our home appliances. Well, what they may not realize is Samsung has a very deep and long-standing commitment to healthcare. So a really good example is in 1994, Samsung established the Samsung Medical Center. It's a large tertiary care facility based in South Korea, provides some of the state-of-the-art best care. But what we're realizing is that care is moving outside of the hospital, and we're starting to develop solutions that can help patients as they leave the hospital and as they stay at home. So Samsung has a few areas that we're spending a little bit more time focusing on, one of which is within the hospital, the other is outside of the hospital, specifically as people are on the go, and the third is within the home. We sometimes refer to this as our in-hospital, in-health, and in-home pillars. Within the hospital setting, we've been focusing on specifically solutions that can improve the clinical workflow efficiency. So in working with partners like Epic, we've been really trying to understand some of the EMR, EHR tools and how those best can be used within our existing mobile platform. The other is around communications, improving the communications with clinicians, specifically nurse to nurse, nurse to physician, and other clinical staff. And what we've been realizing is that there's some great secure texting tools like Tiger Text that have provided us tremendous value on our tools as well as within the hospital environment. And then also we've been looking at within the patient experience, what are ways that we can improve the patient experience, specifically like reducing pain, decreasing stress. And virtual reality is found to be a great tool for that. We have a terrific partner, Applied VR, that's spending a lot of time thinking about how these can be used and really proving that it can reduce pain and lead to better outcomes. Within the in-health space, we oftentimes sometimes refer to this as our digital health or our connected care space. We have been looking at ways that we can change the user experience for individuals that may have implantable devices, for instance. So we work with leading medical device companies such as Medtronic to understand what is that user experience. Can we change it? Can we make it better? So today, many of them may pull out this big clunky device that kind of calls attention to their disease. It could be something that could be streamlined on a smartphone or a smartwatch or a tablet. And these are the things that we're doing. We're changing the experience for patients with diabetes, patients that have restorative therapies that allow them to do neurostimulation, infusion pumps. So a lot of exciting things in that area. We've also been looking specifically within the clinical trial space, trying to understand, can we improve that experience? Big focus nowadays is on patient-reported outcomes. How can we better capture those patient-reported outcomes in a more seamless way? So working with partners like Integron, which does a lot of the clinical trials, they're starting to use more smartphone-based wearables, and Smart Monitor, which is an incredible, really powerful tool that allows us to be able to capture patient-reported outcomes directly on your smartwatch. These are the areas that we're finding to be of tremendous value as individuals are on the go. So in the home, the individuals that oftentimes stay at the home a little bit more frequently than others tend to be older, specifically seniors over the age of 65, over the age of 85. And what we found is that if we can build in solutions that can help seniors live independently, safely, it can provide some great value for not only the senior, but as well as the caregiver. And potentially we may be able to reduce health costs. And what we found is that solutions like Rhew, which is a tremendous solution on a wearable, allows seniors to be able to feel independent. They can actually go around. If there's an emergency, there's a personal emergency response system directly embedded on the wearable. There's a level of geo-tracking so individuals can know that they've gone within a certain range or even outside, will be alerted. And we're finding that that can be a tremendous tool for us to help give that security. One of the most important things that we'd like to communicate is that Samsung has a mission. And its mission is to deliver technology that will improve the lives of the healthy, the aged, the sick. And as part of that, we are thinking about some of the biggest problems that we face today in healthcare. So for instance, the rising healthcare costs. How can some of these digital health solutions reduce the total cost of care? We've also been thinking about the opioid epidemic, pain management. Can we use solutions like virtual reality to be able to use as a non-narcotic alternative to some of the things that we're seeing today, which are afflicting millions of people? And then the other is at home. As we all age, we find that it's difficult for us to take care of ourselves, to take care of our loved ones. Is there a way that technology can allow us to be better connected, to allow us to be able to live longer, healthier, and safer lives?